Stacy York, and I'm a licensed clinical social worker, a mother, and a wife, and I am the founder of Be What's Right in a world that focuses so much on what's wrong. And RIGHT stands for role model with integrity, genuineness, honesty, and trust. And so I wanted to visit with you today a little bit about some of the frequently asked questions that I get. One of the first things that people ask me is, how do you find a therapist for your family? And so I think this is a great question. A lot of people are looking for a therapist or a counselor when things aren't going so well, and especially a child therapist or a kid therapist, it's important to ask a few questions. One of the first things I always say is you got to find the right fit. So if you go in and you meet with a therapist and you think, oh my gosh, this person has no idea that, what's going on with my family, and it doesn't feel like a good fit, then look for another one. Because sometimes, therapy is all about the therapeutic relationship. And if you can't trust who you're working with, or if you don't like the person you're working with, it's going to be really, really hard to make the progress and work on some of the difficult things that you have to work on. So first thing I think is important is just to find somebody who feels like a good fit. It's important to listen to your heart and your gut on that issue. You also want somebody who's skilled, somebody who's had some experience in working with children and families. You want to know what's their training, what are some of the techniques that they use, what do they understand about child development, brain development, those kind of things. And then you want to ask some important questions like, how do they handle issues of confidentiality? Definitely therapists are people who are mandatory reporters, which means that if a child is being hurt, either by themselves or by someone else, or if they are going to kill someone, we have to report that to higher authorities. And you want to know how that's dealt with, how the therapist you're going to choose deals with those issues. But more importantly, you really want to know what's going to happen when your kiddo is talking to a therapist and comes up with some things that might be dangerous or unsafe, things that you should really know as a parent. How is that therapist going to answer that? Some therapists will say 100% confidentiality. Whatever your child tells me in a room without you is between me and that kiddo, and I can't tell you. Other therapists might say things like, if your kiddo tells me something, I'm going to work with your kiddo to tell you, because really, a therapist, especially for a parent and a child, is about facilitating communication. And you also want to know if that therapist is going to work with the family, or is it just a therapist who's going to see only the child? And in my opinion, professionally, personally, whatever you want to call it, I think that the therapists who work with the family are the most effective therapists. I think it's super important to include parents in on what's going on with kids. Now, I also have the experience and the understanding that sometimes kids will tell a therapist one-on-one things that they won't tell their parents because they're scared of a parent reaction or how the parent's going to buy into that or what's going to happen. And so sometimes it is important for a therapist to meet alone with a kiddo, knowing that they're possibly going to come back together. So I think it's really important to ask those questions to find out what's going on. And then you also want to know about insurance, health insurance. It's really important to ask those questions. What are fees? What is covered? If the therapist is a provider for your health insurance, how does their billing stuff work? Those are important questions to ask. So definitely ask, what's their training? What's their experience with children? What do they understand about child development? Are they a good fit with you and your family? What is their take on confidentiality? And then, are they a provider for your health insurance, and how does that work out? So I look forward to seeing you on the other side. Thanks.